here that honestly sometimes you need to surgically remove, and that'll be our last resort if needed. But these bigger scars I'm actually going to treat. Perfect right in there. I'm going to do a first pass here on just some of the sun damage that he has, just overall redness. I'm going to do his nose right now. I'm going to do his cheek area, which we already did. This is just to get rid of some of the flushing, some of the redness and stuff that's left over from scarring. Now we're going to change the setting. Hold on. And we're going to treat the scars. So now we're going to focus on getting some of these thicker scars that are here to be less thick. We're going to also laser those in a second and do TCA cross, which I'll show you in a second. So we'll start first with this. Okay, so now we're going to go to where he has some of the thicker scars, and we're going to do again the stronger VBEAM. Here we go. That's going to be more of like a shock. We're feeling where it's thicker. Okay. Let me turn this way so I can get that other scar. So he has also right here. And right here. And then over here. You can see that whitening right here when I pull the skin. So the VBEAM is going to break apart some of that. You can see the purple, that's perfect. Turn this way. See the purple here, you guys? That's what we want. Alright. So that's really it for the VBEAM. Now what I'm going to do is I'm going to get him real dry. And we're going to take a look. If you guys see, he has a lot of porous scars. Okay, you can see here, you can see here. So we need to treat those with TCA cross, which is a really strong chemical. Turn left. Perfect. So you guys can see all these scars here. We're going to put a little acid in. Okay, this is 70% TCA. Now, the problem is you don't want to overdo these because you don't want them to get bigger, and to improve this you're really going to have to do multiple treatments over time, but this will be a good sort of starting point. And you guys will see we can go over all these bigger scars that have these sort of deep crevices. We call these ice pick. And you'll see in a second they're going to start to whiten up.
Are these good? Is TCA good for pores?
It is, but to be honest, if you don't do it perfectly, it can make them worse. So it's very important if you're going to do it for pores, it's done well. This is going to need a series of treatments, and it's going to need a combination. Okay, you guys see how it's starting to turn a little white in the scars? We're trying to damage the wall of these scars so that when it rebuilds itself. How is the pain?
I can't feel it.
Good. He's doing great. So the dark color is the VBEAM. You can see that the scars now turn towards me all the way. Good. Perfect. So we're gonna do the same thing. Rosa, will you bring a light over here? So we're gonna shine a little light on the skin so you can see some of the deeper scars. You can see a lot of the redness that he had is going away already from the VBEAM. Turn to me a little more, just a little bit. Good.
How many sessions does it usually take?
Usually about 3 to 6 when it's done well. Depends, we have to kind of follow it and see. It doesn't need a ton. You guys can see it doesn't have a lot on this side as much. Okay, turn left now.
Angel says,
Sorry.
"Hi, Dr. Emer. Finally caught you live."
Oh, thank God, you got me. I can't wait. So make sure you follow along and tell people about it. So, we're doing really meticulous. We're going into all the sort of deeper scars that he has. Nice and slow. You have to have, what do you need to have when you have TCA? When you do TCA, I always ask people this. What's the most important thing you need to have? Patience. Okay, because it takes time for the acid to work. Shine over here now. So pretty much we've gotten all the spots. This is a good sort of starting point. Turn left for me all the way. Turn right for me all the way. There we go. We're gonna follow over here again. Take a little look. Couple little spots.
It says he has great facial structure. Is that you're doing also?
No, that's genetics. He has the perfect face. He's got the perfect facial shape. They like you. They're probably gonna ask you out. That's the problem. We're not telling you his Instagram, okay? You gotta leave my patients alone now, okay? Turn. Okay, so we're gonna get a couple of these. We should have Emer bachelors.
Yes, we should.
Turn left after they've had work done. Okay, they go through a year of doing a treatment plan, and then we do a bachelor show. Okay, turn back here. Perfect. So stay straight. Let's get the rest of these.
My biggest advice would be go on Accutane sooner than later.
I agree, but you know, a lot of people, I even had some people yesterday were saying some bad things on my Instagram about Accutane, but I think the key is when you have bad acne, you need to treat it right away. And Accutane is probably the only cure, in my opinion, for acne. You can do diet changes and peels and creams, and it can improve the skin, but it can always come back. You never know. Accutane is going to be the closest sort of option to getting a cure, and in the right person's hands, it's safe. Hold on, don't talk for a second. There's little pores by his mouth. Let's see this bigger one here, right here.
They're saying they would watch Emer Bachelor show.
They would. Okay, well, we're gonna pitch it to a network. Turn this way. Perfect. All right, well, we might have to pitch that now. That would be great. Okay. Turn left again. Shine over here for me. I think we pretty much got it all. Kind of do a little scan. These are all just normal pores. Scan your light. Turn right now again one more time. Let's see, we're scanning. So some of these, you guys, these are just textural, and these will improve when we do laser. Good. All right, so that's TCA. We'll get to the laser in a second. So now we just did his ice pick scars and the redness, and then the next portion is going to be our laser combination.